decrease spinal movement اللي هو الشيبر تيست. الشيبر تيست راح تشوفون هاي الصورة، عفوا. بالشيبر تيست راح ناخذ نقطة هنا نحددها، نرجع ناخذ 5 سنتيمات below and 10 سنتيم above. ايش كده راح يصير عنده 15. طبعا وناخذ خط هنا نسوي نأشر بالقلم ونأشر بالقلم زين، ونقول للبيشنت دنكر. من راح يدنكر راح يزيد عندنا الخط زين. نورمالي لازم ايش قد يكون 5 سنتيمات، نورمالي لازم يكون 5 سنتيمات and above. tender sacroiliac joint، من ندوس على sacroiliac joint راح نشوف tenderness، decrease chest expansion and decrease hip movement راح نشوفها، kyphosis in thoracic spine and reduced lumbar lordosis. إذا تلاحظون الصورة راح تشوفون kyphosis of the thoracic and decreased lumbar lordosis. Okay. Imaging, as we said, establish راح نشوف bumbo-like spine. Patient with early disease can have normal X-ray, and if clinical suspicion is high, MRI should be performed. This is much more sensitive for detection of early sacroiliitis than X-ray. راح تشوفون هذه X-ray، راح نشوف هنا زين الساكروإليايتس، هذه بالساكرم زين ساكروإليايتس. راح نشوف هنا بامبو لايك سباين زين، هذه النورمال فيرتبرا. هنا شو راح يكون الديفيوجن فيوزد فيرتبرا. اوكي. management of aim of the management are to relieve pain. طبعا no definite treatment and the stiffness. Maintain a maximum range of skeletal mobility and avoid the development of deformity. Education and appropriate physical activity are the cornerstone of the management. Early in the disease, patient should be taught to perform daily back extension exercise including morning warm-up routine. هذا نعمله روتين. Swimming is ideal exercise. Poor posture must be avoided. يعني القعدات اللي يقعد مدنقر والقعدات اللي ما مرتاح بيها should be avoided. Non-steroidal and analgesia are often effective in relieving symptoms and may alter the underlying course of the disease. Peripheral arthritis can be treated with methotrexate or sulfasalazine حاله حال rheumatoid arthritis, but these drugs have no effect in axial disease. Anti-TNF therapy should be considered in patients who are inadequately controlled with the standard therapy. ما يفيد معاهم السلفاسلازين, and they frequently improve symptoms, but they does not prevent or alter natural history of the disease. Local corticosteroid injection can be useful for persistent plantar fasciitis, other enthesopathy and peripheral arthritis. يعني مرات بالplantar fasciitis نضربه local corticosteroid، مرات إذا single knee joint inflammation أو single joint نضربه local corticosteroid injection. Oral corticosteroid may be required for acute uveitis. من يصير involvement of the eye هنا نحتاج oral and aggressive treatment, but do not help spinal disease. Severe hip, knee, shoulder restriction may require surgery. Another subject اللي هو هم seronegative اللي هو reactive arthritis, previously known as Reiter syndrome, is one of the seronegative spondyloarthropathy, and so called because serum RF not present. It is predominantly a disease of young men with male predominance 15 إلى 1. It is the most common cause of inflammatory arthritis in male aged 16 إلى 35, but may occur at any age. لو نجي نقول most common cause of arthritis in old age شو نقول osteoarthritis، بس إذا بالyoung age شو هنقول writer disease أو reactive arthritis cause precipitated by bacterial dysentery mainly Salmonella, Shigella, Campylobacter or Yersinia, sexually acquired infection with chlamydia. 2 to 20% of the patient 20% of the patient have HLA positive male develop reactive arthritis. 20% of HLA positive men develop reactive arthritis. Severe form of writer disease occur in HIV infection and a major of them have HLA-B27 antigen positive. Clinical feature reactive arthritis may be presented with a triad اللي هما non-specific urethritis and reactive arthritis زائدا ايش conjunctivitis. إذا eye conjunctiva and urethritis زائدا ايش reactive arthritis. But many patients presented with arthritis only. ما راح نشوف الباقي. The onset is typically acute with an inflammatory oligoarthritis that is asymmetrical and target lower limb joints such as knee, ankle, metatarsal and metatarsopharyngeal joint. Achilles tendinitis and plantar fasciitis may also present. Low back pain and stiffness are common and about 15 to 20% of the patient develop sacroiliitis. Fever, weight loss can be occurred. First attack of arthritis is usually self-limited, but recurrent or chronic arthritis develop in more than 60% of the patient. Several extra-articular features may also include like circinate balanitis, keratoderma bilineuragica اللي هي hyperkeratotic lesion in the sole of the feet, toe, penis, and the palm. These lesions are indistinguished from postulate psoriasis. Nail dystrophy with subangular hyperkeratosis is common and is indistinguishable also from psoriatic nail dystrophy theory يعني يشبه psoriatic arthropathy. Mouth ulcer, conjunctivitis, uveitis, and uveitis can progress to blindness without treatment. ولهذا نحن نقول urgent steroid treatment. Other complications are rare but included aortic incompetence, conductive deafness, conduction deafness, defect, pleuropericarditis, peripheral neuropathy, seizure, and meningoencephalitis. Investigation. The diagnosis is usually made clinically but non-specific diagnostic test may require to exclude the other diagnosis. يعني حتى نحن ندايجنوز reactive arthritis لازم أنا عندي rheumatoid negative, ANA negative, anti-CCP negative. وإذا عندي HLA positive هذا راح يدعمنا diagnosis. B27 positive. ESR may elevated, white BC may be high, and mild normochromic, normocytic anemia راح نشوف. HLA B27 positive in 80% of the cases. Rheumatoid factor ANA are absent, should be absent. Urethritis may be confirmed in the 2-glass test by demonstration of mucoid thread in the first void specimen that clear in the second. Plain radiography اللي هي just articular osteopenia of the affected joint. زين حال rheumatoid, erosion and joint space narrowing in more advanced disease, periostitis and reactive newborn formation at the insertion of Achilles tendon and plantar fasciitis. Sacroiliitis قد يكون unilateral or bilateral, indistinguished from ankylosing spondylitis. Vertebral bridging osteophyte sometimes seen. Management in acute attack should be treated with rest, oral non-steroidal and analgesic. Intra-articular steroid may be required in patients with severe synovitis, Non-specific chlamydial urethritis is usually treated with short course of doxycycline or single dose of azithromycin, and this may reduce the frequency of arthritis in sexually acquired cases. Treatment with disease-modifying anti-rheumatoid drug should be considered for patients with persistent marked symptom أو recurrent arthritis or severe keratoderma plenorachia. فقط بهاي الحالات نحتاج disease-modifying anti-rheumatoid drug. Anterior uveitis is medical emergency and requires topical and subconjunctival or systemic corticosteroid. Another title which is enteropathic arthritis، يعني نحن مرات ما بس اللي عنده يعني اكو relation between Crohn's disease or inflammatory bowel disease and rheumatological disease. Refer to enteropathic seronegative arthritis associated with bowel disease اللي هما ulcerative colitis Crohn's. It is predominantly affected the large lower limb joint اللي هما knee, ankle, hip, butt, wrist, and the small joint of the hand and feet can also be involved. Arthritis usually coincide with exacerbation. من يهيض عليه المرض يصير معاها sometimes يصير معاها arthritis. Exacerbation of the underlying bowel disease and sometimes is accompanied by aphthous mouth ulceration and iritis and erythema nodosum. Patients with inflammatory bowel disease may also develop sacroiliitis and ankylosing spondylitis, which are clinically and radiologically identical to classical ankylosing spondylitis. It is improved with effective treatment of the bowel disease and can be cured by total colectomy in patients with ulcerative colitis, but disease-modifying anti-rheumatoid and biological treatment is occasionally required. And thank you for your listening.